Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I am here today with my amazing and ageless co-host, Dr. J. Calvert. How are you?
I am ageless. I am not aging. That's the way that I see it.
That's the way I see it. That's how it should be. I mean, we are plastic surgeons.
That's
Why
right.
should we age?
Aging is optional.
I agree.
So
I opt out.
Yeah, and that's what we're going to talk about today is age as it relates to plastic surgery.
As it relates to plastic surgery. And so specifically, what are the medical risks associated with having plastic surgery as one gets older? And then also, what are the challenges that we as the plastic surgeons face in creating aesthetically pleasing looks for the older patient?
Yeah, I mean, and age really is sort of optional. I mean, a 50-year-old today, voila, is very different than the 50-year-old that I saw as a 10-year-old kid.
Absolutely.
They're really different.
Totally different. That whole thing like, oh, you're over the hill when you're 40. Like, I'm sorry, no, that's not a thing anymore. Can we move past that? And that whole, little silly saying age is just a number. Well, it kind of is just a number, especially if you have been doing a good job of taking care of yourself over the years. And certainly I have patients that are in their 50s that are in amazing shape. They're running, they're triathletes, they swim, they've been taking good care of themselves. And for them, age really is just a number. And then I can have some patients that are 35, 40, diabetic, overweight, smokers. And for them, they might as well be 60. So in that regard, yes, age could be just a number, but really it comes down to how healthy an individual you are. And this is in regards to how well you will tolerate general anesthesia and surgery.
For sure. And it also relates to the response of the body, the organism, the human that is being surgerized, that is being operated upon. Because operating on a, Sean, you'll have to cut that. Operating on a 17-year-old nose is very different than operating on a 50-year-old nose.
Right. The tissues have changed over time.
Very much so.
Very much so. So let's just do sort of a basic medical thing about surgery in general. We kind of touched on this when we did our obesity and plastic surgery talk, but there are some medical concerns that arise as a patient gets older. We all know that with increasing age comes increased risks of heart attack, stroke, vascular problems, hypertension, all things that could have potentially worse outcomes with general anesthesia. And for that reason, I have sort of a pretty, standard protocol of what I do. Anyone over 40, 45 gets an EKG. Everybody gets a medical clearance. We all get labs. And I sort of put it back on their primary care or their cardiologist to tell me that this patient is medically optimized or is at a low risk or moderate risk for the surgery that they're going to have. And once I sort of get that A-OK from their primary doctors, then I'm comfortable proceeding with surgery. That being said, there is no guarantees. There is always risks the older you get with some of these systemic complications, but thankfully they are very, very rare, at least with kind of surgeries that we do.
Well, and on the patients that we operate on, I mean, you have to remember the anesthesia classes of, the outpatient setting. We are not taking ASA, anesthesia risk categories 3 and 4. We're doing the 1s and the 2s, which means that they are essentially low risk for general anesthesia.
Low risk for anesthesia, although I will say I probably do the 3s in my hospital setting because I do have
you do.
older patients who have had bariatric surgery and still want some abdominal contouring. And thank God I'm doing them in a hospital setting because that is where I feel more comfortable doing them. But I do have 67, 72-year-old patients coming in for tummy tucks, and they've had 100-pound weight loss, and they've had a history of diabetes, they've had a history of blood pressure. So I do have experience doing less than optimal candidates for plastic surgery, but I do them in a hospital setting. And generally, overall, from the systemic situation, they do okay because they have been cleared as okay for surgery. But what I have noticed in my older patients is that it just takes a little bit longer to recover from anesthesia, from surgery in general. These are patients where their blood pressure may fluctuate a little bit more afterwards. When they stand up, they might get dizzy, a little bit higher risk of falls. Sometimes there's a little bit more of a brain fog that lasts for another day or two after anesthesia. It just takes longer for their mind and their body to bounce back.
Yeah, I mean, that's the thing, is you're going to see the difference in abdominoplasty on a 32-year-old woman who's finished having babies and is ready to get her mommy makeover versus the 62-year-old massive weight loss patient are two totally different operations. They're
Totally
not even close.
different. Not at all, for so many reasons. But the take-home message is that it can be done. There will be some differences, and that is our job to look at the individual patients and decide if they are safe and appropriate for surgery. And then even after surgery, maybe just monitor patients a little bit differently if they have any of these risk factors for being, a little bit longer or slower to recover.
So let's say we're talking about that 62-year-old massive weight loss patient who wants the abdominoplasty. Do you order a stress test, or do you leave that to their clearing physician?
I leave that to their clearing physician. I am not a cardiologist. I am not a trained expert in it. I do not deem to step on toes. So if they have a heart history, they usually have a cardiologist already.
Right.
If that's the case, then I do specifically request cardiology clearance in addition to their primary medical clearance. And then I leave it up to the cardiologist to do whatever tests they feel necessary to medically optimize or stratify that patient. And just to sort of clarify, we use the word medical clearance pretty loosely, but medical doctors and cardiologists don't technically clear patients for surgery. What they do is they look at patients' risk for surgery, and that's based on their age, their weight, their history of hypertension, diabetes. Have they had a previous heart attack? Have they had a stroke? What kind of surgery are they having? And then they do what they call risk stratification. And so we'll get the notes back from their doctors that say, my 22-year-old's having a breast aug, low risk for a low risk surgery.
Right.
My 65-year-old patient with a history of diabetes, history of maybe remote heart attack that's now lost 100 pounds, they will say moderate risk for a moderate surgery. So that just gives everyone an idea that there is a little bit of increased risk,
right,
but they are comfortable letting them go to surgery without doing any additional interventions like a cardiac cath or a stent or anything like that.
Yeah, and that's really key because you want, we always have patients sign consent forms. They say, what are the risks of the surgery? We tend to go over the risks of the operation itself, but there are
bleeding,
risks
infection, blah, blah, blah.
Right,
yeah.
You could need, scars that are unsightly,
Right.
et cetera. Those are sort of risks of having these specific operations, but the risk of general anesthesia alone with doing nothing, there are risks. If we just took you to the operating room
And did nothing.
induced anesthesia
Anesthesia.
and put you to sleep and woke you up,
Yeah.
you do it enough times, there can be a problem.
And that is a very real risk of having general anesthesia. So it can be done safely. And there certainly are measures that we take to make sure that it is done as safely as possible. But yes, there are always risks. And when I get that question from my 67-year-old patient, am I a good candidate for an abdominoplasty? Yes, but this is going to be a different recovery, and there are different medical considerations for you than for someone who's younger. And particularly the type of surgery as well makes a difference, because a 67-year-old having a facelift for 4 hours or a 67-year-old having a total body abdominoplasty and liposuction surgery for 5 or 6 hours, totally different risk factors, because now we're talking about fluid shifts, fluid coming in, fluid coming out, how that affects the heart, how it affects their blood pressure. Facelift, after the surgery, after the anesthesia is out of your system, there's not really a whole lot of fluid shifts happening, strain on the heart, things like that.
No, facelift is a face, skin, and subcutaneous tissue operation.
Right.
It's not like you're getting into areas that are going to affect the internal organs, because when you do that abdominal plication, it changes things.
It changes
the
things.
game. And that can affect your overall physiology. It can affect just the way that your body works. I mean, it can affect venous return from the legs to the heart, like all those things. And what that it just basically means is that it has, higher impact on your body that your body must accommodate for and heal.
In a systemic way, it affects your body.
Correct.
Yeah.
A facelift is pretty benign.
Yeah, that one's usually pretty well tolerated.
Same with a nose job. Rhinoplasties are pretty well tolerated. The only time that I see a lot of swelling and a big hit from a rhinoplasty is when I have to do a really major septal reconstruction and you're in on the skull base, and it is,
it's a little
you get a little bit more, you get a little more swelling, a little bit more bleeding, and it can be a bigger hit. When you're just kind of doing a, make my nose pretty rhinoplasty, it's not as high impact.
Right. And so those are the medical considerations when we're talking about older patients. But then there are just the aesthetic considerations that happen with older patients that are way different than the younger 25-year-old coming in for a breast dog. And usually it relates to the quality of the tissues.
Right.
So even if you are a patient that has been really good about sun exposure and you've been using your Retin-A and you've stayed out of the sun, you've been a good girl, you still have the effects of aging on your skin. Some worse than others, but it's still there. And like you were saying with the noses, the tissues are just more brittle, the cartilages.
Well, and the big reason for that is as we get older, our collagen chains get shorter. This is like the actual physiology of why aging really starts to show up. And
Which
just
is why every anti-aging product out there says, builds collagen.
That's right.
It builds collagen.
Sure it does. When you can get my genetics to pump out some more collagen, it's going to make the difference. So what happens, the collagen is a protein that makes up skin and soft tissues, and it's an important building block protein. So if you have big, long chains of collagen, they take on more water, they're plumper, they make things look better. And when they get shorter, they start to clump up and get a little more disorganized. And so like that's where, and you and I were talking about like a breast augmentation in the 18-year-old versus the 72-year-old, which I've done. Mm-hmm. It can be done, but it's hard.
It is hard. Breast implants in older patients are really, really hard because you are fighting two separate battles here. On table, the immediate problem is that there's just a lot of extra skin. And yes, we can remove skin with mastopexies, but the skin that's left behind is not great quality skin. It's lost its ability to kind of snap back and stay tight. And so it's not going to form and shape itself around that implant to the extent that you want it to. It's going to be kind of like a ball in kind of an empty bag kind of situation, no matter how much or how tight we pull that skin around it. And then over time, that implant is going to fall because the skin trying to hold it up is not great quality. So it's going to relax and it's going to loosen. And pretty soon that implant that started out, in a good position within like 6 months has now fallen and still a lot better maybe than before, but it's not going to be high and perky like it was. And that's the tissue of the breast. And then there's the tissue around the breast, so the skin of the side of the chest wall.
Oh, yeah.
Oh, that is my nemesis. That skin is just, even the skinniest of patients, the healthiest of patients, that extra skin on the side of the breast is sagging and it's loose and it drives me nuts.
It's like a squirrel suit.
And there's nothing you can do about it short of cutting it out, which is not really a great option for most people. So as long as you know that that's going to be there and it may or may not detract from the appearance of the implants, you just got to know that that's part of the deal.
Yep, that bra fat, armpit, side of the chest wall, squirrel suit skin. It's terrible. It really wrecks the look.
It really does. And it's just... you think of breast implants and you think of these like really pretty and perky breasts, but it's just not that when you have older aging skin. And not to say that we can't make a nice looking breast with implants. You just have to adjust your expectations. You are not going to have the pretty 25-year-old breast implants.
That's usually what I tell people to do before listening to our podcast.
What's that?
Adjust their expectations.
Adjust their expectations.
You won't be
Adjust
disappointed
yourself.
that way. But it's true. You have to say, look, see this stuff here? It's going to be there afterwards.
Still
We're not
gonna be
going to
there.
cut all up on your arms and down the sidewall of your chest. I mean, you can, but those scars are not.
Those are real
That's
scars.
a pretty rough trade.
And the same thing for liposuction. Like after a certain age, I just refuse to do liposuction on patients because I'm like, it's not going to give you what you want. And your skin is going to be so loose afterwards, and it's going to show every lump and bump from the liposuction. It's just, I know what you're asking me to do, and I know what you want it to look like afterwards. And liposuction alone is just not going to do it for you.
No, it's not.
No.
You got to cut that skin out. At a certain age, it's got to be taken away.
It's got to be taken away. Same thing for a Brazilian butt lift. I had that consult today. And a lady that wasn't even, she's not older per se. She was in her 50s, but she has some loose skin of her buttocks. And she was asking if she was a candidate for a Brazilian butt lift. And she really didn't have a lot of fat. She was a normal average BMI person. Like, you really don't have enough fat to get the look that I know you're talking about, because any kind of loose skin in the buttocks is going to prohibit that volumized buttock look from the fat. Like when you see these nice big butts from Brazilian butt lift, it's young girls with tight skin who have a moderate amount of extra fat to give, and you put the fat in the butt and it just blows up and it looks great and it's perky and it's bouncy. But if that skin's not tight and it's loose, it's like filling an empty bag with just, it
just
fluff.
keeps taking it.
Yeah,
too.
you never see a difference. So you got to really consider the quality of the skin on a lot of these procedures and realize that you are not in the category of that cute little model that you saw on that plastic surgeon's website.
Nope. It's okay though.
That's okay.
Because we got other options.
We have options. We got options.
I recently
we got you.
did butt implants in a 65-year-old.
That's an option.
It's an option. And you know what? Looking good.
I bet. That's sort of where
Looking
you have
good.
to go with
you
that.
do.
at
You
that
put the
age.
volume in. It's like,
Yeah.
there it is.
Or you got to do some cuts and lift some skin or take away skin. So, yes.
And she had a butt lift. That's why she came to the implants, because she had
Got
weight loss, had a butt lift, and now like her
There's
butt
nothing
like
there.
just goes from like her like spine to her legs.
Mm-hmm. Yeah, I make a lot of those butts with my with my lower body lifts, my butt lifts, and the weight loss patients. Because once you lose weight and then you have extra skin, you pull the skin up and you cut it out, there's nothing left to
Nope.
make a butt.
There's
There's
no butt.
nothing. And I'm not a big fan of putting implants in at the same time as that surgery. So I say the same thing. Have your butt lift, get rid of the extra skin. Then when the skin is in a good place, come back and we can put in implants. But yeah.
Yeah, and facelifts too. It's the same thing. You've got aging skin. There's upsides and downsides to that. The upside is that your scars are going to be better.
Scars are amazing in
Yeah.
older skin. Like
They are.
they become invisible.
They are. They're great. But the downside is that the skin can still be crepey.
Right.
And 3-4 years after the facelift, you're like, oh, what do I do? And then it's usually put some fat in there.
Right.
There are options, but you have to kind of go on the journey with any plastic surgery.
Any
really.
plastic surgery. Time, age, gravity. They're always going to win. That's what I tell people all the time. And so everyone always asks, well, how long does the facelift last for? 10 years-ish. But know that we're not stopping time. Time and gravity are going to continue to work on your new facelift. So you're going to need it touched up. You're going to need it pulled again. These beautiful actresses in their 70s and 80s that look amazing, Jane Fonda, they've probably had 2, 3, 4 facelifts. I'm not saying she has. I'm not putting that out there. Don't quote me. But to keep looking that good, usually you need a little more tuck every couple of years, and
Sure.
then tuck a little more, and then tuck a little more. And that's just part of the deal if you want to maintain.
Absolutely. You cannot. We have not figured out how to stop time.
No, not yet. We're working on that.
That is the truth. But
Actually, I am working on that. You know why? Because every once in a while, my son will ask me, if you could have a superpower, what would it be? And hands down, every time I say, I just want to stop time. I need a couple extra 3 hours in my day to just zoom around and get stuff done. I need more time. I need more time. So I am working on that as my superpower. Stopping time.
that's a good superpower.
Right? You
Yeah.
get so much done.
Yeah, I think that would be a good one for you.
Yeah.
You're definitely an errand runner, and and I think that would really help you. You could get your cobbler more
My
often.
cobbler, my tailor, my seamstress, my dry cleaners. Every weekend.
That's true. Well, good. Anything else about aging plastic surgery patients? Since you and I are that.
Apparently, yes. No, just know that definitely an option as long as you are otherwise healthy, relatively healthy, and just know that there are going to be some differences.
And you just have to plan it and execute flawlessly. That's always the key. I
agree. Well, I think that's about it. So this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.